Alright, so here's the heart, right? Here's your aorta right here. Okay, first branch off the aorta, brachiocephalic trunk. Second branch off the aorta, left subclavian artery.
Oh, that's really good.
Okay, notice how long it is.
Okay.
Okay, easy to ask. So, branching off the brachiocephalic trunk, you're going to have 3 arteries. If I sort of pull this, that vein, I mean, technically you don't need to know that vein, so. Branching off that brachiocephalic trunk, you can see 3 arteries, right? The right subclavian here, and then both common carotids. The right common carotid here,
Oh, yeah.
and the left common carotid here. Okay. Now, both subclavians, when they pass the body wall, so find the ribs and use them as a landmark. Anything before the ribs, subclavian. After the ribs, axillary. All the way till you get to the arm. And then when you get into the arm, okay, whatever you have here is going to be brachial. Okay. Now for the veins here, superior vena cava here, technically in the cat's anterior vena cava. First branches here off of that, those are the brachiocephalic veins, here and here. Okay. Now right here where it branches, see that branch? That there it becomes the subclavian vein, same vein though. This branch right here that goes with, tiny little branch that goes with the carotid artery, that's the internal jugular vein. This big one out here, it's always easy to see is the external jugular vein. Okay, now subclavian veins here, okay, when it branches, or when it goes through the body wall, it becomes axillary vein all the way to the arm, and then in the arm here it becomes the brachial vein. So here's your brachial artery and vein right next to each other there. Okay, so the aorta is going to go down here, down the back side of the thoracic cavity, and then it's going to go to the diaphragm here. When it comes through the diaphragm, okay, right here, it becomes the abdominal aorta. And it will be the abdominal aorta all the way until it branches there. Okay. First branch off the abdominal aorta goes to the stomach, liver, and spleen. That's the celiac trunk. Second branch off the abdominal aorta goes to the intestines over here. That's the superior mesenteric artery. Okay. Next will be the branch that goes to the kidney. That's the renal artery. Technically, there's going to be gonadals here that we're skipping. Okay, and then you get to this little branch that also goes to the large intestine here. That's the inferior mesenteric artery. Okay. We're going to skip this branch here too. Okay, when the abdominal aorta sort of gets to the end of the line here and branches, the big branch that's going to go through the body wall to the leg is the external iliac artery. Okay, the one that goes down deep inside to the pelvis here, that's the internal iliac artery. Now, as for the veins here, okay, underneath the heart, here you can see the inferior or posterior vena cava, right? That goes through the diaphragm. Okay, it's still posterior vena cava when it comes out the other side. Only branch you're going to be able to see here is the renal vein. Okay, and then that's it until you get all the way to the bottom. When you get to the bottom here, we're going to have a tough time seeing this. You guys don't have any pins on.
No.
Do you have those stripping needle? Alright. So when we get down to the bottom here, okay, when the inferior vena cava branches, this is the common iliac vein. Now notice that right here, the common iliac vein forks into a branch that goes into the pelvis and a branch that goes to the leg.
Yeah.
The branch, branch off the common iliac vein that goes in here is the internal iliac vein. The one that goes out here to the leg is the external iliac vein. When it comes out the other side of the body wall, it's now femoral vein. All right.